8. Ailments related to respiratory system. Two types of respiratory ailments are commonly observed on board. In the first one, adequate supply of oxygen could not be acquired by the body due to restriction in the breathing system, such as the food consumed might have choked the windpipe, or a fractured nose or ribs might have created congestion in breathing. This subsequently might generate asphyxia. The second case is just the opposite of the aforesaid first case. In this, the body procures more quantity of oxygen due to rapid breathing, or due to continuous administration of oxygen for a long time, which reduces the carbon dioxide level in the body and produces hyperventilation. Asphyxia. This might turn fatal if the cause of restriction of breathing is not removed instantaneously and adequate supply of oxygen to the body is not restored. As such, an immediate action is absolutely essential in this case. Symptoms and signs. The patient complains or shows signs of not being able to breathe properly, viz., gasping. He or she feels dizzy and might even faint. The pulse of the patient rises rapidly first and becomes slow, feeble and irregular thereafter. His or her lips, nose and fingers turn bluish. The patient shows signs of restlessness and would feel frightened. Treatments. Extricate the cause of choking immediately, if possible. If any foreign object, like food particles or such, is stuck in the wind passage, slap the patient quite firmly between the shoulder blades. The patient's tongue should be prevented from falling back. Turn his or her face to one side. Cover the patient with a blanket or sheet. Administer artificial respiration if the breathing stops. Oxygen should be administered after the revival of the patient. Hyperventilation. This happens due to intake of excessive oxygen, because of which the patient has trouble breathing. In other words, this is caused by the excessive loss of carbon dioxide from the body. Symptoms and signs. The breathing of the patient becomes shallow, rapid, and irregular. He or she experiences tingling and numbness of lips, cheek and fingers. The patient becomes excited, frightened and nervous. He or she might experience lightheadedness, giddiness, and blurring of vision. The patient might also faint. Treatments. If conscious, ask the patient to hold his or her breath, or to breathe at a slower rate inside a clean air sickness bag, in order to inhale more carbon dioxide and less oxygen. This process affects the gradual restoration of carbon dioxide and brings about the balanced level of carbon dioxide and oxygen necessary in the body. Reassure the patient through counseling to ease his or her tension and excitement. 9. Heart attack. This ailment could range from a mild one, angina pectoris, to a severe one, coronary occlusion. In both occasions, the patient would be imperatively necessitating and must be provided with utmost and immediate care and attention. Cabin crew members are to be prompt with their actions, because this ailment tends to be fatal with wastage of time. Earlier the treatment, better would be the result. Symptoms and signs. The patient experiences a very severe pain shooting from the chest to the left shoulder and further to the left arm. The patient sweats profusely. The patient gasps for breath and would be restless. The patient's face becomes pale and the nails turn bluish. He or she would feel nauseous and might vomit. The patient's pulse is either very slow or very rapid, not normal. The patient might lose consciousness. Treatments. The patient should be restricted from making even the slightest movement, as far as possible, and indulging in exertion of any kind. Recline the seat back to make the patient comfortable. Loosen all tight clothing around the neck, chest and waist. Direct the air loose towards his or her face. Administer oxygen immediately. A doctor must attend to the patient at the earliest. Such arrangements must be made. 10. Stroke. This occurs when a blood vessel in the brain ruptures or is clotted. It usually transpires to elderly persons suffering from blood pressure and hypertension, though young people may also suffer from it. Symptoms and signs. The patient experiences a sudden weakness and numbness which might immediately be followed by loss of consciousness. Part of the body could become paralyzed. The patient might lose control over the urinary bladder. The pulse of the patient would show surprising anomalies by being either slow but strong, or weak and rapid. The patient would breathe deeply and/or snore in unconsciousness. Treatments. Recline the seat back of the patient. The patient should not be allowed to move and/or exert even the least bit, and is to be covered with a blanket. Administer oxygen immediately. The arrangement should be made for the patient to be attended by a doctor at the earliest. 11. Intoxication. A passenger might board a flight in an inebriated condition, or might acquire such condition, eluding the cabin crew on board. The cabin crew should be careful enough not to hurt his or her feelings, and at the same time, prevent him or her from being a source of nuisance on board, disturbing the co-passengers. Severe cases of intoxication might even demand first aid. Symptoms and signs. The stench of alcohol is present in the person's breath. The pupils are dilated with reddening of the eyes. The speech of the patient is slurred, high-pitched, and he or she tends to talk excessively. The patient might sleep or lose consciousness after some time. Treatments. Wipe the face of the patient with a towel soaked in ice water. Administer smelling salt. Administer oxygen, if needed. 12. Poisoning. This could initiate from various factors, including the food the passenger has consumed on board, food poisoning. The symptoms vary on the potency and the quantity of the poisonous substance consumed by the person. Symptoms and signs. The patient reacts with violent nausea and vomiting. The patient experiences severe pain in the abdomen. The patient experiences muscular cramps. The patient might feel restless or drowsy and might pass into a coma. Treatments. Force the person to consume an emetic. In absence of regular emetic, the patient must be made to consume a huge quantity of warm salt water repeatedly to make him or her vomit. Do not induce vomiting if the poison consumed is of corrosive nature. The arrangement should be made for the patient to be attended by a doctor at the earliest. Summary. In this module, we have learned that first aid is an action that either cures or at least restricts the illness from aggravating further till the time a qualified medical practitioner attends the sick person. Passengers suffer from various ailments while undertaking a flight because of their inability to accept and to adjust to certain environmental conditions during the flight. The physician's kit contains various life-saving medicines and sophisticated medical equipment. The contents of first aid kits may vary in their number or brand, but usually remain the same.